Now we look at how the most vulnerable part of the family, that is the child, fare in case of Pakistan. What we will talk about the child care, child protection, and child services. To understand the child rights, we have an international gold standard, which is the United Nations Conventions on the Right of Child, which is CRC. It is the most widely ratified human rights treaty in the United Nations. 196 countries, almost all of the UN members except the United States, have ratified this treaty. It was adopted in November 1989 and ratified and came into force in 1990. So, in focusing on CRC, we look at it. The rights of the child fall under four main themes. The first is survival, which is the child's right to the basic requirements of survival. The second is protection, which is child's rights to be protected from all risks to their well-being. The third is development, the child's right to develop to their full potential. And the fourth is participation, children's right to participate in decisions related to them. How is CRC implemented? Each country that ratifies the CRC periodically reports its achievements. These reports are discussed at the UN, and then there will be non-binding recommendations to the country, which the country is supposed to accept, but they are not binding on it. Pakistan was the sixth in the world to sign the CRC, so it was very enthusiastic to work for the benefits of its children. But gradually the things have not gone as planned. So if you look at the 2018 UNICEF's annual report on Pakistan, there are some achievements, of course, but there are many other things which we had to do. So the data in the rest of this module comes from this 2018 UNICEF annual report. The first point, every child survives and thrives. So during the last year, more children are vaccinated, more children have been given vitamin A supplements, more children have been dewormed, more children have been screened for acute malnutrition, and more health care facilities have looked to improve their working as far as mother and children are concerned. Every child learns. So more children are being literate. Around 1 lakh children were given high quality early childhood education. 1.2 million new children were enrolled through UNICEF supported government enrollment campaigns. Sindh non-formal education program or policy plans to enroll 6 lakh out of school children in the next 5 years, and Punjab and KP are also working on their non-formal education policy. Every child is protected. So protection for every child from violence and exploitation. More than 4,000 adolescents were trained in life skills. 2 regions of Pakistan, that is Gilgit-Baltistan and Balochistan, have passed the CRC-aligned legislation to protect their children. Birth of around 4 lakh children were registered with the UNICEF, and around 25,000 children benefit from the psychosocial support provided by the UNICEF. Now we come to the safe and clean environment. More communities have become open defecation free. More campaigns and targeted communications have been done to make more communities defecation free. Access to safe, clean drinking water has been increased, and water quality has been improved. Every child to have equal chances. And in case of Pakistan, the main disparity is the gender disparity. So more work has been done to improve girls' access to education, access to high quality and quantity education. Over 1 million young people were reached through social media for No Choti program, which affects girls much more than boys. Lastly, every child withstands crisis. So Pakistan's school safety framework was approved by the Prime Minister. More than 4 lakh children were protected in 500 Islamabad schools under the school safety framework, and around 9 lakh children in Western KP, that is FATA, were vaccinated against measles. So if we look at these figures, these are much discouraging. Only 42 children of every 1,000 die in the first month of life. In 2012, 15% of the children received the minimally accepted diet, but this portion or proportion or percentage was decreased to 13%. So rather than increasing, it decreased by 2%. In some areas, we have improved, like the ratio of fully immunized children in Pakistan was 54% in 2012, and it was increased to 66% in 2018. If we look at the learning aspect of the children, we still have to reach the goal of having 4% of our GDP for education. Currently, 2.8% of GDP is given to education, even when most of our population is still illiterate and cannot even write their names. So there is severe disparities exist relating to access of education. So if we look at Islamabad, 96% of the girls of the primary age are enrolled in primary schools. Compare it with Balochistan, where only 35% of the girls are enrolled in the primary school. So we have to change these, improve these disparities. Coming to the protection against violence and exploitation, 66% of the children experience physical harm or punishment in their homes and schools. The birth registration is 91% for the richest families, but only 45% for the poorest families. 76% of the children experience psychological aggression in their homes and communities. So, looking at the safe and clean environment, 64% of the population of Pakistan is without access to safe drinking water. And 39% of the population do not wash their hands after defecation. So these things have to be improved if we want our children to live fully developed lives.